For pretty much all of human history, profound blindness was just a fact of life, irreversible. But what if it wasn't? What if we could actually rewrite our own biology, or maybe even bypass it with technology, to bring light back into a world of darkness? Well, we're right on the edge of making that a reality. So let's dive into this incredible new frontier of restoring vision.
And look, this isn't science fiction. This is a real headline from just a couple of years ago. It's a genuine milestone. This one sentence, it just captures this huge shift in what we thought was possible. And the whole story really starts with one person's incredible experience. Just try to imagine that for a second. You go from a world that's just vague light and shadow to suddenly being able to see distinct shapes, like the stripes on a crosswalk. This one patient, after the treatment, couldn't just see the crosswalk, he could actually identify and count things on a table. It's that single, tangible result that makes this such a mind-blowing breakthrough. Okay, so how in the world was this even possible? Let's unpack it. This didn't happen overnight. It's the result of more than a decade of really hard work on a revolutionary approach called optogenetic therapy. The idea here is just wild. You're not replacing the cells that have been damaged. Instead, you're giving the cells that are left a brand new job. Researchers basically hijack nerve cells that are still healthy but can't normally see light, and they trick them into becoming tiny light detectors.
So here's the play-by-play. With his condition, retinitis pigmentosa, the main light-gathering cells die off. But deeper down, other nerve cells, the ganglion cells, they often survive. The therapy uses a totally harmless virus to basically deliver a light-sensitive protein into these surviving cells. Then, the patient wears special goggles that project pulses of a specific amber light into the eye. That light activates these newly sensitized cells, and bam, they send a signal to the brain, creating a whole new form of vision.
Now, this one incredible story is really just one piece of a much bigger puzzle. Right now, scientists are basically hacking our visual system from two totally different angles. One is biological, and the other is electronic. So here are the two main strategies. On one hand, you've got the gene therapy we just talked about. That's the biological rewiring. It teaches old cells new tricks. And a huge plus is that it could work for lots of different genetic causes of blindness. Then, on the other hand, you have retinal prostheses. You've probably heard them called bionic eyes. This is an electronic bypass. It doesn't even try to fix the broken parts. It just goes right around them to send a signal straight to the nervous system. And believe it or not, the basic idea of zapping the brain to create spots of light, that goes all the way back to the 1920s.
So this is what one of these things actually looks like in the real world. You can see it combines the outside part, the glasses with that little camera, with an implant that's surgically placed inside the eye. It's a seriously complex piece of engineering, all designed to bridge that gap that biology left behind.
Let's walk through how this works, step by step. First, the camera on the glasses captures what's going on. That video feed then goes to a little processing unit. And this part is fascinating. It can use AI to simplify the image, maybe highlighting the edges of a door or the shape of a person's face. That simplified signal gets beamed wirelessly to the implant inside the eye. Finally, the implant's electrodes fire off, stimulating the nerves and causing the user to see patterns of light called phosphenes. Over time, their brain learns to interpret these patterns as a kind of vision. Now, we have to be realistic about what kind of vision we're talking about. The best sharpness, or acuity, reported so far is 2546. To put that in perspective, 2200 is considered legally blind. So no, this is not a full restoration of natural sight, but it is a massive, life-changing leap from total blindness. It lets people detect large shapes and get around much more easily. So we have these incredible, yet still imperfect technologies. How do you even begin to measure the real impact on a person's life? Because this isn't just about reading an eye chart. It's about the quality of someone's life, day in and day out. Well, to figure that out, health economists use this metric called the Quality Adjusted Life Year, or QALI for short. It's actually a really smart concept. One QALI equals 1 year of life in perfect health. So a year lived with a health issue that lowers your quality of life might only be worth, say, 0.7 QALIs. This lets us put a number on the real benefit of a treatment beyond just how long you live. So, using this QALY measurement, researchers calculated the potential lifetime benefit of a successful gene therapy for a different retinal disease, and the number they came up with was this one, 14.3. What does that even mean? It means for a 20-year-old who gets treated early,
The therapy is projected to give them the equivalent of over 14 extra years of perfect health over their lifetime, compared to if they never got the treatment. That is just a staggering way to quantify what it means to prevent a lifetime of losing your sight. But here's the most important takeaway from that whole study. It's all about when the treatment happens. Just look at this difference. For a 20-year-old, the benefit is huge. For a 45-year-old, it's still pretty significant, over 6 QALIs. But for a 60-year-old who has already lost most of their vision, the gain is way smaller. The message could not be clearer. With these kinds of therapies, the earlier you intervene, the bigger the benefit over a lifetime. It really makes a powerful case for early diagnosis. Okay, so this technology is incredibly powerful. But with that kind of power comes a whole new set of really complex ethical questions that, honestly, we're just starting to figure out. So the next step in all of this is integrating artificial intelligence. An AI-driven implant doesn't just show you everything the camera sees. It actually decides what's important for you to see. It might prioritize a friend's face in a crowd or an obstacle in your path. Now, that sounds helpful, right? But it also opens up a huge can of worms. Like, who's in charge of the algorithm? Who decides what's important? Is it you, the company that made it? What if the algorithm is biased? An AI making choices about your perception of reality? That is a massive ethical leap. And what about the device itself? This isn't like a smartphone you can just toss when it's obsolete. What happens if the company that made your implant goes bankrupt? Who's going to provide the software updates? Who pays to get it taken out if something goes wrong? This problem of post-trial abandonment is a very real, very scary issue for patients. And as we get closer to even more advanced neural implants, like ones that can decode what you want to say, the lines get even blurrier. The developers themselves have raised this alarm bell. Where do you draw the line between decoding an intention to speak and literally reading someone's private, internal thoughts? The whole idea of mental privacy is suddenly not so theoretical anymore. Ultimately, all of these breakthroughs are forcing us to ask a much bigger question. The kind of vision these devices create, it's not natural vision. It's a whole new kind of perception, filtered through cameras and electrodes and AI. As we get this incredible power to restore a human sense, we also have to think about what version of that sense we're creating and what it really means to see. The technology is moving way faster than our ability to answer these questions, which means we need to be having these conversations right now.